People think there's a massive conspiracy that doctors are hiding whooping cough, but that's not true. Wait till the end of the video where I explain that. But this comment expresses a common misconception about whooping cough, which even I didn't know until I looked it up because I was making some content on it. The vaccine for Bordetella pertussis, which is the bacteria that causes pertussis, also known as whooping cough, is given in childhood because an infection with Bordetella pertussis can cause absolutely devastating effects on children, and particularly babies under the age of 6 months. In some unfortunate cases, it can cause death, and this is more likely to happen if the person is under 6 months old. But these vaccines start to wane in their efficacy within 5 to 10 years of them being given. And this is one of the main reasons why we offer the pertussis vaccination to women who are pregnant. It's because it helps to protect them and their newborn baby before the baby is able to start having vaccinations themselves. Now, the reason that people think that there was a conspiracy is that the first stage of whooping cough pertussis is that it presents like any kind of viral illness, in that there's a cough, there's a fever, muscle aches, tiredness, runny nose, snot, and all of that stuff. It's really hard to differentiate it from any other kind of viral illness. It's only really as we enter the second stage of the illness, which by this point antibiotics and things are pretty much useless, where we start noticing the coughing fits, possibly the vomiting after the coughing, and then that really loud gasping during those fitting episodes where it's like that sound is made. But it's not a conspiracy. It's just that these infections have essentially almost died out, and the vaccine has been a victim of its own success. So not only have we kind of forgotten about these illnesses generally, but we have also forgotten about the memory of these illnesses. And that's because vaccines work. But now, because of this massive rise in the number of cases of whooping cough, when I see a patient with a cough, it is part of my differential list now. A year ago, it wasn't really part of any of the diagnoses that I was trying to include or exclude because it was so rare.